Hello, my name is Ash, a counselor in training. This is my Relatable study podcast for individuals who need help studying for their NCE, CPCE, and other related counseling exams. I'm going to go through many questions from multiple resources and make the answers relatable to both you and me. So get your listening ears on and let's get studying.
The human relations score for effective counseling includes A. Power, competence, and trustworthiness. B. Expertise, attractiveness, and trustworthiness. C. Empathy, positive regard or respect, and genuineness. D. Self-image, self-talk, and attending behavior. The answer is B. Experience, attractiveness, and trustworthiness are the human relations core for effective counseling. Because when the counselor has the expertise and the trust with and for the client, they're able to build on that rapport and work through the client's issues. Whereas attractiveness, I would recommend doing research on this because I know little information. Which of the following is not a common role for a member of a therapy group? A. Facilitative. B. Autocratic. C. Maintenance. D. Blocking. The answer is B. Autocratic is not a common role of a member for a therapy group. The common roles for a therapy group is facilitative, maintenance, and blocking. There are several roles within those three groups. I would recommend going through each group and seeing what kind of members there are. Prior to the 1960s, most counseling took place A. in a group setting, B. with the entire family present, C. in a dyadic relationship, D. in a behavior therapy clinic. The answer is C. Prior to the 1960s, most counseling took place in a dyadic relationship. Dyadic relationships are between two people, and within the counseling and psychotherapy setting, that relationship between the two people are the therapist and patient, or the client and the counselor. What is Down syndrome? Down syndrome occurs when an individual has 3 of the 21 chromosomes instead of 2, and Down syndrome causes 20 to 30 of all cases of severe and moderate intellectual disabilities, and around 80% trisomy 21 pregnancies end in miscarriage. The classical physical characteristics that are associated with Down syndrome are slanted, almond-shaped eyes with folds, a large protruding tongue, short bent fingers, and they appear to age rapidly. A group has A membership which can be defined, B, some degree of unity and interaction, C, a shared purpose, D, all of the above. The answer is all of the above. A group has a membership which can be defined, some degree of unity and interaction, and a shared purpose. If a group does not have these 3 things, then it is a cluster of people in a recognizable unit. That is all 5 questions for this episode. Thank you for listening. Keep calm and study on.